Hi, good evening, everyone. I am Chien Kang, and it's a nice and a special hour can to introduce the Aidite new product to you. And the Veneer is a special material designed for the veneer. And we know that Aidite already have a very nice Zirconia material that is the 3D Pro. And then we know 3D Pro is almost perfect the material can to fit the all indication. And it also have a very nice material property, and we don't worry to use it design a long span restoration. And the latest material is 100% from the torso, and this is my favorite material. And come back to think the 3D Pro can we can use the 3D Pro to design the anterior crown or bridge or posterior or implant restoration, and finally we also can to use it to design the long span bridge or the veneer. But the special things in the veneer indication is interesting because the 3D Pro is the multi-layer and the multi-translucent. So sometimes we want get more high translucency. That is not the perfect. So the added design and the development, the new material is the Veneer. And the Veneer can give us the almost the same glass ceramic translucency, and we can get a more better bending chance. So that is a good news for us. And you can to see about the when we design the veneer restoration, sometimes the thickness is very thin, almost 0.4 to 0.6 millimeters. And in this situation, you can to see the veneer is very close the glass ceramic translucency. So that is good and fit for the design veneer. And this is the paper guideline that I think is not a big thing, and is not a special difference with the glass ceramic. And in this product line, and Aidite and me, we create the seven different color. Is the extra white and the bleaching white, high value and low value. And we also design the bleach white multi-layer color and the high value white multicolor and the low value multicolor. And this is interesting if you want just design the normal and very close the shade guide veneer restoration. You just choose the multicolor and the rate to glass, and you get you want. And sometimes for the non-prep or minimal prep, we can use the extra white or bleaching white. And some participants maybe have confused why we design a special color to fit the Vida tape. And I just told you for veneer, sometimes this situation just dentist dentist just prepare the enamel area. So we just to design the enamel color and the enamel translucent. So we don't to design the choose the dentin color. So this is interesting. And if you want to make the more low value or very deeper color, I think that you don't care translucent. You just choose the 3D Pro, and that also can to fit to you. And we also know that this is a nice material from the torso. And this is the linear color chair, and I separated this for 3 area. And what is these 3 area? And this is also another interesting history. And when we want to create the more the brightness and the bleaching color, nowadays is very popular and the fashion. So when we want to create the very brightness and the bleaching color veneer restoration, sometimes we will lose the translucent. But the Aidite design a very special color is the extra white, and this is the special and can give you a very high value brightness and whiteness, but don't to lose the translucent. So when we use this veneer on a different situation, maybe the A1 the stump share or to the A3 stump share, you also can to use the bleaching white and the thickness just the 0.0 millimeter or 0.6. You also can get the bleaching color, and don't worry lose the translucent. So this is very interesting, and this the color chart can help the dentist or the technician to easy choose that you want the material and the thickness. And this is the color chart is a neutral wrong, because when we use the low value, because we know the neutral teeth, the enamel close, the edge part is more low value, and it's not really brightness. Just only bleaching teeth have the very brightness, the color and the value, but neutral teeth is almost the low value, and so you choose the low value easy near black and and you can create the more like the neutral teeth view. And we also can choose the multicolor black, and very easy to fix the you want the final result, and just with the glaze the treatment. And finally, if the very dark the shade number, maybe the A3.5 or A4 or the brown dark or like the root color, and when we use the EWBW or the multicolor, you also can make your teeth more brightness, and you can do change the color. But sometimes this is a little just cover the color, but you can get the 100% totally right to match the Vita shape. This is the interesting, because almost when you just use a veneer, you want to change the final color is difficult, but we can to change the value and make it more brightness. So when we use the easy near, want to change or improve the patient's teeth, and we use this material, we also can to get the more brightness, the more close the neutral teeth. And if you want to make it very dark or very low value teeth like A4 or root, and you want the final result is really like the neutral A4 or A3.5, I think you just choose the 3D Pro, maybe A3.5 or A4. You don't use the veneer easy near this material. And for the easy near, Aidite also create the shade tape, and this shade tape is different like the Vita Pen or the 3D Pro shade tape is like the piece, and have the different thickness, and we also create a smaller curve. So when we use the shade tape, you can direct use it in the patient's mouth to shade taking, and you also can apply the little maybe the liquid or the translucent gel on the back, and you can direct use it put it in the patient's mouth, and you can direct to view the color change, and that is more easy help dentists to choose the right material shape, and also can help for the dental technician make their work is more easy. So you can do see is interesting. In this area, we can do see the color is a little change, and this is almost 0.4 to 0.5. So we know choose this thickness, and we can do change color like the final result, and you also can to show it result to the patient, and can to decrease the complaint or argue. And for when we use the easy near material, we can get more good benefit and advantage, because this is lower cost than the glass ceramic the block, and that is the more high bending strength, and also have the more good biocompatibility than the glass ceramic, and the that is also can to get the better detail and the margin and the surface texture than the glass ceramic, because that is the enlarged to meaning, and so we don't worry our margin error is easy to cheap when we meaning. And this is also can easily get the multicolor and help you faster to finish your job, and you don't worry to need to stand a lot of times. Maybe just use the glass the technique you can to finish the patient, and the easy process for the digital workflow, because the Zirconia is the digital workflow, and this is a good benefit and a good workflow for the dental laboratory, because the many dental laboratory to make the glass or ceramic still use the place the technique, so that will lose a lot of them time, and you need to waste up investing and appraise and developing and Chien. So this is a very long and difficult workflow. But for this digital workflow, you can to save the data, and you can easy to reproduce, and very fast to meaning to get that you want the final result. And I know that maybe the user have the confused and big the question about the bonding of the Zirconia material, and we must to know the first thing. Bonding is the tools and the resin cement and the Zirconia, but during the tools and the resin cement and the Zirconia frame, we also have the bonding agent and the ceramic the primer. And this is interesting is we want to improve and make this the ceramic primer have a good function, and then we can make it to easy get the good bending strength with the resin cement. And the structure, the bonding agent, the dentist's work is not the technician's work. And we must know the first thing, what is the Zirconia surface pretreatment before the cementation. We must do the three things: is clean and make the rough surface and make the surface activation. And how to do that? If we want to clean the surface, we can use the sandblasting, or maybe a special liquid either cleaner, or we can also use the acid etching. And then we want to create the surface become the roughness, we can use the sandblasting or use the acid etching. And then you want to activation the surface, we can use the sandblasting either clear, or use the now is a special technique, the plasma, or use the NDP primer. And then when we do this, we can make the bonding strength is more good than with the resin cement. So it's the procedure and the step. So in my opinion and my experience, I like use the sandblasting or the etching to get the roughness and clean the surface. And another thing is use the NDP primer to make a surface activation. And then now final step is use adhesive the resin cement. And this is interesting and big discussion topic. Why? Because if a dentist create if dentist prepare if the dentist preparation the veneer tools for the dental technician, if you prepare the retention foam and you don't worry a lot of the problem with the bonding, because we have the retention foam. But if it is non-paper or paperless or like a BPR restoration design, is no retention foam, this step is very important, because the Zirconia without any glass crystallization is without any the glass inside, so we can use the acid to etching it, get a rough surface, and also don't have the reaction layer. So this is not good for the resin cement bonding, and also not good for the ceramic primer. So if possible, follow these three steps, you can get the good and enough bonding strength. But nowadays, I know that many companies design a different Zirconia bonding function, the bonding function, the technique, maybe like zero coils. They have a very high percentage the acid to etch in the Zirconia, but it's also have another problem, because this way is a high risk for the workflow, because this is also danger. And after the etching, the Zirconia frame maybe will decrease about the chains and also affect a few zirconia property. So this is not good. But this is direct mechanical etching, and you can get a very roughness surface. But the risk is effect about the strength and make the property is a little change. And maybe DMAS company, they have applied the special glass, the liquid, you can apply it before the sintering. But after the sintering, we don't know the release or how many the glass on the surface. And after the trying, maybe they will damage and or we will lose that. And the bigger problem is the we can to find any data about this solution. So this is it's like the secret, and we don't know what about the bonding strength for this the technique. And another company, the Zirconia etching cloud system, is also like the DMAS, but is the after the sintering we use the maybe 90%, 90.5% the acid to etching our zirconia. But this is also no any data reference can to support this concept. So I don't know how about their function or how about their really bonding strength, because no any data or any article is like the DMAS. But for real coils, we have some data references for support, and we can to see and to check. But the problem I say is the high risk for the user, and another problem is the strong acid will affect the zirconia strength and the property. So if possible, maybe we can to think just if we can to think if we can to make the zirconia like the glass ceramic, and how to do. The Aidite also to make the new product is the Biomig, the DC. This is a special DC silicate supply, and we can direct use it the supply on the zirconia surface after the sintering, and just the one bag program, and we can to see it's very interesting. Our zirconia is integrated into the the DC connects the layer will interfere into the zirconia surface, and that can get the mechanical strength, bonding strength, and the outside become the silicate. So in the clinic, we wanted to we wanted to cementation the zirconia veneer or zirconia crown, just follow the glass ceramic the etching solution, and it's very easy and no risk, and very fast, and you can get the same or better than the glass ceramic bonding strength. And if you're interested, maybe you can to contact Aidite and to ask this the new product. So you can to see this is a raw material on the zirconia surface, and after this bag supply the DC connector, and after this connector etching, you can to see the SEM the photo. This is like the this silicate and the glass ceramic the surface. So this is interesting, and this is easy workflow and no risk, and we also can get a very strong bonding strength, the same the glass ceramic with the neutral teeth. And this is the case report. And the fact, if we want like create the bridging teeth, now it's very popular. Many patients like this. You can do see this patient, this lady, his lower teeth is more yellow and dark, but you wanted to make the bridge in the upper teeth, and I chose the easy near, and I use the bridging white, and use the this connected supply in the inner core and the back, and the outside adjust the shape, and use the Biomig the stand outside, and I finish this case. And in the patient's mouth, the dentist finish, and the cementation solution is like the same glass ceramic. And also like this patient is the same, is more the caries or the dark or discoloration teeth, and he also wanted to make the bridging teeth, and this is just the high value. And also the same solution, I use the this connected spray inside and the back, and then adjust shape, and I use the biomix stand on the outside, and you can do see after cementation in the patient's mouth. It's a bridging teeth and very like the glass ceramic, but this solution and this technique and this workflow is very easy and faster than the glass ceramic. So for this solution and with the easy near material, we can very fast give the patients one result and also faster finishing the dentist job and save the clinical time. And if you want to create your veneer more like the neutral teeth, and also you can use the easy near, you can choose the easy near material, and the rate use the external stain or apply the very micro layer porcelain on the surface, like this case. Is the two discoloring anterior to central teeth and the two lateral teeth we want to create a veneer. And I also to use the 3D Pro for the crown and use the Easy Near for the veneer, and apply the supply the disincarnator in the veneer inside, and I apply the color liner to cover the discoloration tooth in the central teeth inside. And this is the interesting case and the interesting indication. And this is the final result, and we can do see. I use a micro layer skill and the biomix stain. I finish the two veneer and the crown, and we can get the neutral view. But if you want to create the you want to create a bridging teeth, you just use the extra white or bridging white multi. So this is the easy way. So finally, this material, if you interested, you can to find many information from the Aidite, the Facebook or their website. And if you interested, you can to send a mail to contact them. And this is a very interesting and a very high translucency Zirconia material in the marketing. And if you interested, maybe you can do try it. And thank you for listen, and thank you for your attention. Okay, I just change back for the edit. Thank you.